Medication management is a big issue because it's really easy in the busyness of your day to get things kind of confused or mixed up.
With the Pyxis ES system, with the upgrade, if we have patients that do have the same last name, which does happen, it's a bigger hospital, it will bold their names or put them in red so we can see that there's name alerts on there. It can show us patient allergies and right dosages and maybe the last time that they had it. You don't want to administer something too soon.
I definitely like what we've got going on now. I feel like the organization is a lot better. It's really helpful to have something that will alert you. It's kind of like that extra step to help check you before you continue.
You have a list of your patients and you can go back to a list of all the patients for the unit, and then individually for your patients it'll show time frames.
You can see what's due not only at 9 a.m., you can see 10 a.m., 11 a.m., 12 p.m. So you can kind of see what's due now versus what's due an hour or two from now. So you can see if you can consolidate care. It just is really helpful in mapping out your day.
The Pyxis ES system appeared to be more IT driven than anything else from my perspective.
Before we had to type in a username and a password, and the password was not necessarily the same as it would have been for our charting system, and now it's all integrated and it's one and the same. It's our employee number, and we use our fingerprint actually to gain access.
Prior to the Active Directory implementation with Pyxis ES, new hires was always a struggle because it was a paper process. So with Pyxis ES and the communication between human resources, we're able to get that in a more timely manner so that when the nurse does get to the floor for their orientation day, they have access to Pyxis right away.
The extra time is great because I'm able to do more in-depth assessments. You have everything kind of separated, so you have your scheduled medications, you have a tab for your PRNs, and you have a tab for anything that you're not going to pull directly from the Pyxis, but we're going to be pulling from the patient's individual bin. It's kind of a no-brainer going one patient to the next and being able to get done what I need to get done.